This is the same one, and I kept this slide just because I wanted to show that guy's, oh, you can't even really see it, that guy's hand. Diabetic ulcers are quite dramatically healed by application of that. Neuropathic ulcers, a big problem in diabetics. Interesting, this would probably be interesting to you guys for a lot of reasons. This company, Regenix in the States, in Colorado, friends of mine actually, these guys have started a commercial operation giving people mesenchymal stem cells injected into their knees, which theoretically regenerate cartilage, anti-inflammatory in nature. To give you an idea of how anti-inflammatory these things are, when we began injecting into dogs that had quite serious osteoarthritic change in their knees were like people's knees, big, swollen, crepus when you bend them around, and obviously a lot of pain. When we injected the stem cells, within the space of around about 72 hours, the circumference of that stifled joint had decreased by about 30%. So it was really quite dramatic anti-inflammatory response. These guys are interesting for another reason, in so much as they are flying in the face of the FDA. The FDA does not like untested, unregulated therapies. And in fact, in 2005, they classified autologous stem cell transplants as being a drug under pressure from the multinational drug companies who don't like this stuff. You can't patent this stuff. That's the problem. But these guys, you know, they've had some good results. And people who had nowhere to go but total knee replacements. Yes, ma'am?
Why are they so anti-inflammatory?
That's a good question. And the answer is I don't know. No one really knows why, but basically they suppress a part of the immune system responsible for the inflammatory response. If you take non-steroidal anti-inflammatory drugs, for instance, Nurofen, there's a whole range of those, of course. If you take those, you know about the COX-1, COX-2 inflammatory cascade. Those interfere with that cascade by stopping enzymes in that process. The anti-inflammatory process of stem cells seems to be that they suppress part of the immune system that is responsible for that, bringing that anti-inflammatory stuff to that site. So we think that's the way that they work. I'd like to be a lot more specific about that, but once again, because we don't really know which one of those three things, all those three areas I told you about how they work, actually does the job, we think that that's the process. Another interesting aside to that question, and it's a good question, there's a thing called graft-versus-host disease. Graft-versus-host disease is a bit like rejection of a transplanted organ in reverse, where the transplanted organ becomes immune to you and it starts producing antibodies against you. Now, this occurs occasionally in kids who have had bone marrow transplants, where the bone marrow transplant begins to produce antibodies against the host. And it's really quite dramatic. The temperature goes sky high. These kids actually die from this. And they tried the normal non-steroidal anti-inflammatories. They tried corticosteroids. And these kids, this was a group in Sweden a couple of years back, and none of those things worked. As a last resort, they put mesenchymal stem cells injected in this kid. The temperature plummeted in 12 hours. This kid survived. So they are dramatically anti-inflammatory, but we don't actually know how. Okay, getting back to these guys here. Yeah, if you've got sore knees, you probably would want to go here, rather than get a total knee replacement. Corneas. Eyes are a biggie, not just because of corneas, and this is an old slide now. Just yesterday I got an email from a guy in the States giving me an article about the new way of doing this. The old way of doing it was you got this contact lens here and you grew the cells up on the base of this here and you whacked them on the lens here, they merged with the damaged cornea and they repaired the damage. Nowadays we've dropped out the lens and we just whack them on direct onto the eye. The cells are taken from the limbic area here where the cornea and that white scleral junction is just there. So we get a few of those there and you grow up in the lab and they really repair corneal damage. And they had, yesterday that email said they had 9 people whose sights were 90% restored by just pasting on these stem cells. But more importantly, you've all heard of age-related macular degeneration? Yes? Okay. You probably know people who are going slowly blind for this black thing in the middle of their eye. These stem cells that we take from there, you can apply them at the back here and they regenerate the retina as well. So we're getting success in, my colleagues at the University of Moscow have done this in dogs and they've regenerated retinal tissue to the point where these blind dogs and one horse, can actually see again, and they've been blind for a couple of years. So regenerating sight with stem cells is a really big thing. The good thing about this is that the eye itself is a closed system, immunologically speaking. What you put into this rarely gets out into the system. So it's not an easy thing to get past regulatory bodies because you don't have to worry about attacking your liver or attacking your spleen or whatever. So it's sort of stuck in your eye and it just does that. Admittedly, you've only got 2 eyes, so you can't really screw up. They should try one first of all, and if that works, I'll try the other one. Okay, so rheumatoid arthritis, you've probably all heard of that. Pretty ugly disease. We don't get rheumatoid arthritis a great deal in dogs, but in people, they use intravenous stem cells for this scenario too. This is a little video, which I'll just put on hold for a sec. I think. Yeah. Okay. This is interesting because there's a company in Melbourne called Mesoblast. Now you'll be hearing a lot more about Mesoblast in the future because Mesoblast use mesenchymal stem cells like we use, but they get them from the bone marrow. And they are trialling a lot of good stuff for a lot of good diseases, one of which is a trial that was completed a couple of years back there, 2008, looking at non-union fractures. Now, non-union fractures are a big problem in a lot of people where the bones just won't knit up. And they can last for years and years. And you can see from these 2 guys in here, I hope you can hear this, it runs for about 5 minutes or so. Royal Melbourne Hospital did this trial and they got dramatic responses to people that had gone through the mill, several operations and nothing worked for them. So just let me know if you can't hear this. Yeah, so you can see that it can be quite dramatic. But I've got to say that that's pretty much old hat now, that stuff. We're certainly regenerating cartilage, no 2 ways about that. I have to smile when Tony said, yeah, I'm back on the bike again. I thought, yeah, Tony's a big lad. Okay, so these guys, Mesoblast, are an interesting company to watch. They came out with a phase 2 trial about 6 months ago, which for me was a real biggie. This is a sheep model, and they regenerated a prolapsed intervertebral disc. Now that's a huge thing. You would know, as being physiotherapists, you would know what an enormous number of lower back problems there are. In the States every year there are between 3 and 4 million. That's a huge, huge market. This is an Australian company. And these guys, by injecting mesenchymal stem cells directly into the nucleus pulposus of a ruptured disc, have regenerated that disc completely. Okay, it's a sheep, but that's proof of principle for me. So I think you'll be hearing an awful lot more about Mesoblast. If you've got some spare bucks, it's probably not a bad idea to buy some shares there. The other interesting thing is that it's been taken up these days, stem cell therapy. Here is the stem cell facelift. Strangely enough, the area code 310 is Beverly Hills. What a surprise that is. Yeah, so these guys are offering the stem cell facelift, and they're also offering stem cell other stuff too, which I've cut off at the bottom there because it's a little bit iffy, that one. Anyway, that's something else on its way too. I'm sure that there'll be a lot of pretty people next time I talk here. This is basically what we do. I've left it to last because it's not all that interesting to physiotherapists to watch dogs, but this is a group in the States called VetStem we worked with about 4 years ago. We did the first stem cell transplant in Australia on dogs about 4 years ago, on my own dog actually. She was quite badly arthritic and had difficulty getting up in the car and harassing the cat and that sort of stuff. And I worked with the guys in San Diego and brought this technology back here, and we decided to give it a try. She went extremely well, and since that time we've probably done about 120 or so dogs. The States have done about 3,500 dogs. There's been no untoward side effects at all, apart from a little bit of joint flare post-operative.